to help. Oh. The session looks as follows. We first would like to start with the video from UNRWA that we will show in a minute. Then we will ask the views of the panelists in one side on if they, we will ask that, first and Olivier to show what has been, to categorize has been shown and to summarize it a bit, then ask the panelists their views on the challenges faced, followed by then of what are the support mechanisms and coping mechanisms that they have witnessed and seen. And then we have half an hour, hopefully, to ask you for your insights and to share with us and with the panelists your ideas for future support, building on current needs. I asked you for two things. One is we have to do strict time management. So sorry, cutting short is not meant to be rude, but can come across rude. This is not intentional. Secondly, we have only one microphone, I think, so we need to be running around. So bear with us for that as well. Okay, so let's start, and let's start with the video. Rhiannon, can you play the video? Thank you.
Has changed. Previous, I had a clear schedule, familiar tasks, duties, along with a regular supervisory visit to hospitals. My work schedule has become non-existent, with tasks arranged on a daily or even hourly basis due to the ever-changing security situation and the continuous displacement of both staff and entire people. A typical day in my life before the war was relatively organized and measurable. I would start my day by preparing for work at the Remedy Center, where I worked as a senior nurse. The clinic itself was well occupied and had steady supply of medical and hygiene material. The workday began with a review of the schedule of duty. We used to provide excellent care to our Palestinian refugees. In addition, we had time for meeting, training, coordination with other health service care. My work has become a major change due to security and safety issues and section patient. Now I have to work more distance to reach them, which has evidence less and less. Despite the difficult conditions of the world, I think keep working with Working at the Gaza Health, I conduct supervisory visits to contained centers. My home DLG at all was damaged while I was still inside and saw this place for the first time from the 8th of October. Now I find myself not only working as a supervisor and manager, but also as a pharmacist and full supply chain with logistic and procurement processes. Our activities are no longer planned. According to the news and other sources, many healthcare workers have lost their lives or left Gaza after the recent war broke out. Could you tell us what made you decide to continue working in Gaza and who and how the gap has been felt? There were many reasons why I stayed in Gaza, including feeling a strong obligation to assist my people and maintain essential health services for the vulnerable, internal and externally displaced persons. I also sought to support my colleagues at the program and stay close to my decision to remain was driven by a sense of duty and the immediate need to help. Gaza is my country and I will not leave, even if it will cost me my life. I feel with work to leave Gaza. The decision to continue working in Gaza despite the recent war was guided by a deep sense of responsibility and commitment to the people who need me here. The situation in Gaza is disaster. Many individuals, especially the most vulnerable, such as the refugees or those with a condition, need our help. We cannot leave them without help. I didn't believe in leaving Gaza state. I felt a profound sense of responsibility to stay and support vulnerable refugees to sustain essential health services. However, it is immoral genocide that would unfold. So we distributed the workload among the remaining staff, and before more, only one shift of the clinics transferred to multiple shifts to provide services for largest possible number, ensuring that services continue even in the face of such overwhelming adversity. We believe we might only be displaced for days. Now, over 11 months later, the ongoing stressors make us physically and emotionally drained. Communication is difficult due to no electricity and no internet connection, and access to clean water is extremely scarce, raising the risk of dehydration and waterborne disease such as gastroenteritis and skin diseases. As a mother, including a child who was terrified of sounds of war, these challenges are particularly hard to bear. To cope, I maintain a routine as I can. Simple tasks like organizing the supplies, staying busy at work, help me momentarily escape the constant fear. My colleague and I support each other, sharing food, water, and we lean on one another for emotional support. We find ways to manage. You are faced with challenges both at work and at home. How do you cope with these challenges? Name some challenges and how you are dealing with them. What do others in your team do?
The challenges we face are numerous and have persisted for over 11 months, leaving us overwhelmed and exhausted. This includes uncertainty, insecurity, ongoing displacement of staff and patients, limited resources, destroyed infrastructure, communication difficulties, and constant stress. Many of our staff struggle with securing basic needs like shelter, food, water, cooking gas, and access to currency. On top of these practical difficulties, we are dealing with significant anxiety, helplessness, hopelessness, and a loss of dignity, all of which contribute to post-traumatic stress disorder for many of us. I am experiencing severe insomnia, weight loss, and mood disturbances, which also affect my family.
There are many challenges with the transportation, with the displacement of people, and the significant effects in dealing with individuals without identification documentation or documents. Additionally, we are struggling with shortage of medical and hygiene supply. Some more problem with electricity and internal internet connection. We are trying to maintain our work despite the poor security situation. We find difficulties find hygienic supply. We buy locally made liquid soap with expensive and low quality. We use it for several cleaning purposes, such as hand washing or substitute the shampoo, dishwashing, laundry detergents.
There are many calls for a ceasefire. In addition to this crucial call, how can the international community support the healthcare workers and health system in Gaza?
Everyone is trying to do their best with the most limited resource. The situation is extremely difficult. We need to provide hygiene supply, clean water, drinking water, proper waste management to reduce spread of disease. We also need nutritional supplement for almost all ages. And available food is mostly canned or frozen with limited nutritional values. This leads to disease like anemia, weakness of immunity, malnutrition. We urgently to provide medication for skin infection disease, chronic disease, cancer, family planning methods. We also need to shelters or suitable working environments.
International community must take decisive steps to protect health centers and civilian buildings to be safeguarded under the international law, even in war, to save the population without interruption. The international community can provide vital support to supply of clean water, essential medicine, and medical equipment system. Moreover, the international community should work to stabilize the financial situation in Gaza and make innovative solutions to the logistical challenges we face. This could include setting up temporary health centers, portable water filtration system, and solar power. Please, only now to ceasefire.
Yeah, so I just wanted to take a moment here before we start to just recognize how unbelievable some of these things are that we're seeing here. And also the video that we saw in plenary, and how speechless that leaves you just to seeing that overwhelming amount of struggle, challenges. And just to recognize also, this video was shared by colleagues from UNRWA, but this is also, of course, shared by many other organizations, many other health workers. And to just, before we get into that, to really recognize that. If you can go 2 steps back, please, Rian. So during this session, we want to somehow give structure to all of this, this unbelievable challenges in a way that sort of makes sense. So what we tried to do together with our panelists is try and see, you're hearing many of these challenges. We try to give them a bit of a structure and try to give a bit of a structure in order to be able to talk to them. So what we came up with is this idea of multi-layered challenges facing health workers in Gaza. And I think in the video, you see a lot of these things. So of course, there's the larger context of insecurity, of the conflict, of destruction that's just pervasive throughout all of this. And we've seen a lot of examples of that. But also in this last video, you see examples of lack of access, of people being internally displaced, also health workers, and not being able to access their own facilities at that level. And this is, of course, something that hits everyone in this conflict. And then I think on the next level, Rian, if you could decide, we see all these challenges health workers face with relation to the health system. So we've been talking a lot, and we're seeing a lot of images of infrastructure being destroyed, of supply chains being disrupted. And there was also a potent quote from the video that said, our activities are no longer planned when it came to the medical supplies. The planning just breaks down. Workforce planning and training, the way that we normally see this, like a workforce is not just a static thing. You would like to make sure that you train enough people, that you recruit enough people, that you keep them in position. All these longer term and structural things are just, they're inhibited. And external workforce capacity and support, the ability to bring in additional support. I think Dr. Nick will talk to this in a bit as well, probably. It's hugely constrained. And then finally, you get to the core, which is, if you can please select the next one. There's really these challenges that directly hit health workers and their families. And in our discussions between Marla and myself, we've been talking about the double burden. You very often see that health workers have a burden in their professional capacity, but very much also in their personal lives. And that goes in all these things. Protection in the workplace, obviously, but also financial support, the lacking of salaries being paid on time, food, shelter. We've heard a lot of these things also in the video. The physical health and the exhaustion of working in facilities day and night, taking on multiple shifts. And then, of course, also the mental support. And we've been talking about that more during this conference as well. The mental support of the patients, requiring additional care to get over this trauma, additional support for health workers to deal with all of these difficulties. But also we heard, the last person saying, my child is scared of sounds and is no longer able to sleep. The effect on families and health workers having to also deal with that. And the social support with their families more broadly, of course, and the loss that you see in those circles it's unfathomable. And then finally, also the training. In the first part, they said, okay, normally we do frequent training, but this has broken down. So what we want to show with this is that these are not all the challenges. There are far more, but they're interrelated layers of challenges that affect health workers, and that makes it so much more difficult to address. So having tried to at least give this a little bit of a structure, we would now like to ask the panelists to respond to this. And I think, Tamam, we would like to ask you to go first with this specification to please use 3 minutes.
So the question he would like you to ask is, from all these different areas that were highlighted, is there anything particularly you would like to react to? Could you, we get them visible? Yes. Can you unmute yourself, please? No, you can't. Can you unmute?
Okay, I think
Yes.
I've been unmuted. Thank you very much. And thank you for having me, and my apologies for not being able to be there with you. I mean, we have heard and seen images from Gaza, and one of the discussions that have happened repeatedly in humanitarian circles is on whether what we're seeing in Gaza is comparable to other conflicts. And I think some of it is, and that is an important learning opportunity where we can draw lessons from other experiences, but some of it is absolutely not. And I think the delineation of the two is very important for us to be able to both react in the immediate moment and plan for the future. So if I may, in my couple of minutes, just give a bit of a framework on that categorization. There's obviously the captive population, the massive destruction that the Israeli war machine has inflicted on Gaza, the repeated and unrelenting targeting of health facilities and civilian structures. There's a maximization of civilian casualties that is intended and systemic that we rarely see to this extent in any other conflict. When it comes to our health system there are 2 points. In many of the conflicts we've seen, you either have a fairly developed health system that remains fairly intact. Think about Ukraine with very few exceptions. Health facilities haven't been targeted, although sometimes they might lack supplies and staff. Or you have a very rudimentary health system that doesn't. So many of the cases aren't treated regularly. In Gaza, I believe we have a sort of worse circumstance in the sense of there has always been a health system that functioned as the guests mentioned. They've worked in oncology, surgery, which we don't see in places like South Sudan or DRC, for example. That has been disabled. So there are chronic conditions and others that have been treated, patients that have had access to healthcare that disappeared overnight. There's a systemic destruction of the available health facilities, and this we know from other situations where the health facilities being targeted repeatedly become a scary place for people who are sick or injured to go to because they're afraid of being targeted in health facilities.
One more minute, apologies.
So I want to try to very roughly categorize things. One is talking about the context and environment where the security of health structures and health workers is compromised, and access where health workers and patients and people who are even more excluded, like women, disabled people, or other at-risk groups, become completely unable to access the health system. The health system itself, where the infrastructure is damaged, impossible to rehabilitate, the supply lines get cut, and the health workers either get affected, die, or get arrested and tortured, or cannot be recruited or trained. Then you have the health workers themselves. And here we have another circumstance where health workers themselves are severely affected, not only medically and financially, but also socially, where they have to worry about their families, their relatives, and so on. I will stop here before I take much time, but will be happy to follow up with this. Thank you.
Thank you very much. I would like then to give the floor to Mohammed for the next 3 minutes. Thank you for keeping the time.
Well, I'm I'm really want to bring like academic and practice perspective in the context of Gaza, as I worked 10 years in the hospitals and primary healthcare centers, and also started after 10 years, you know, researching and teaching public health issues, especially related to the humanitarian crisis. I think when we look at the workforce crisis in the current catastrophic situation in Gaza, we all know that it is aggression and a war of destructing the pillars of the society, including the health sector or health system. And who's running the health sector is the human resource or the healthcare workers. And I look the workforce or the human resource crisis from different angles or perspectives: individual or personal, second institutional, and lastly the health system levels. Individuals, we have to talk about the mental health of the individuals, or the personals, the human resources, and also the incentives, their safety, their actually salary, financial sustainability, and their essential needs like foods, electricity, shelter, etc. Secondly, the institutions, we need to look at the essential medical supplies. Without these supplies, without equipments, without the needed medical devices, you can't actually provide essential medical emergencies, etc., that can be actually provided by the human resources or workforce. The last point, which is the last level, is the health system. We need to reimagine and to rethink about the policies, relicensing the guidelines, the regulations of the related to the workforce. And also we need to think about the health policies that is regulating the workforce within the healthcare systems. So we have actually lost many workforces during this war. Many already detained, many already left Gaza, and we have very limited number of workforces running the health, the collapsed health system. So we need to rethink about the health policies, the strategies, and also the relicensing and accreditation strategies that actually in place in Gaza and also in Palestine in general. Thank you.
You're perfect timekeepers, actually. Thank you. May I give the floor to you, Professor Maynard? 3 minutes.
Yeah, thank you very much. I'm looking at my watch. I mean, I'm going to echo quite a bit of what's been said already, and perhaps put in some of my experiences in recent months in Gaza. The staffing resource there has been hugely depleted, and it varies massively from week to week. So you may turn up. I was at Al-Aqsa Hospital. You might be at work there with a considerable number of local staff, and within 48 hours, 80% of them might have left because they've been recurrently displaced. So they were working at Shifa in October, November. Then when Shifa was initially destroyed, they moved down south. They moved with their families to their tents in the various camps. And then suddenly they'd be displaced again. So overnight, the workforce of one of the hospitals might be reduced by 50%. We've heard many of them have been killed as well, many abducted. There's currently 179 healthcare workers, whereabouts unknown, having been abducted by the Israeli military. We've heard about the infrastructure being destroyed. We hear about 16 hospitals currently partly functioning. Partly functioning is really an overstatement. Some of these hospitals can provide very, very small amounts of what we would call proper traditional medical care because of the lack of staff, the lack of resources, the total destruction of the infrastructure there. And of course, we've heard about the supplies, the medicine shortages, the complete lack of drugs on some days, no pain relief, the continuing water insecurity, the fuel insecurity. And the final comment is really the communication's very difficult there. We've heard, and there have been some wonderful examples, and there was a paper in the Lancet recently about telemedicine supporting Khaled Alsa, who's a wonderful surgeon in Nasser who is currently incarcerated, whereabouts unknown. But of course, many times there is no communication possible at all there.
All right. So we have now seen the video, let the voices of the people speak, heard some insights from the experts on this massive destruction, and all the suffering that is going on also amongst the health workforce. But also, can we now try and see, although it seems, if you look at it from what we've heard and seen, nearly impossible, can we think of how to help the people in Gaza, the health workforce, and try to understand how health workforce at the moment copes and what we can do as outsiders to support them with, of course, the first objective of this conference in mind, Palestinian-led solutions. So I would like to ask first the panelists again to react, and then you have a few minutes for questions and answers, and then we would ask you to also give your insights on this question. Dr. Tamam, can I ask you to answer this following question? We see the very complex challenges that need to be addressed. What do you see that the health workforce in Gaza does to cope? And what do you think the best way forward is for outsiders to build on what is happening at the moment already? Thank you. You have 3 minutes again.
Thank you very much. Very humbly, I mean, we have one of the most resilient and capable health workforces that have been able to provide the absolutely, under absolutely impossible circumstances. I think the first help we need to provide to health workers in Gaza and in Palestine in general is to protect them. It's impossible to imagine an improvement that is significant in the ability to deliver healthcare in Gaza while health workers are systematically targeted. So work on advocacy and political pressure to ensure protection of health workers and health facilities, respect for international humanitarian law, which has been made a mockery of in the past months, is the first step that outsiders can do. And the medical profession and the humanitarian sector. The second one, in my humble opinion, there is a need to distinguish between the absolute immediate life-saving interventions and those that there's a mass triage over a massive population that needs to be done. Under the circumstances, there's very little supply that we can get in. There are exceptionally little numbers of outside medical support that can be brought, whether people or supplies. And under the circumstances, we have untold numbers of people who are suffering direct traumatic injuries. There are people who are suffering chronic diseases that would die without simple interventions. And here I'm not advocating for trauma over everything else. I'm saying with very little resources and massive demand, it is imperative that we distinguish what can be done towards highest possible outcome, life-saving and life-sustaining outcome, and what can wait. This is a massive exercise, and I would never claim that this can be done from the outside. I think enabling that choice and following the lead of health workers in Gaza would be a good triage exercise at this stage under the circumstances. Thank you very much.
Thank you for this contribution. Can I continue and ask Dr. Mohammed to react?
Yeah, related to how ideally the workforce is coping with the crisis and the catastrophic situations, establishing the well-being and safety culture first, or the environment or atmosphere, which is completely missed in Gaza. It is, the workforce is under systematic killing and pressuring from different ways and aspects. Second, we need to understand or to run an assessment to ask the workforce about their essential needs related to personal needs, their personal needs, and their medical needs that within the healthcare system or within the existing facilities that they are running. And also we need to look at the training and education needs and activities. They actually have witnessed unprecedented cases with, I can't describe the situations or the cases that actually attended the emergencies or in the field. They actually saw cases that was not mentioned in the surgical or medical books or in the theories. So this is something that we need to consider very importantly. And also mental status or support or social psychosocial support is so important to keep them, working on the battlefield and in the existing hospitals or facilities. So without that support, so they will be actually deeply diving into different levels of burnout, different levels of depression, different levels of anxiety and concern or griefs, etc. Financial well-being and incentives. They have their families and they need to sustain or to survive financially and to support their essential needs and family needs as well. For the local authorities and international communities, they have a responsibility, urgent responsibility to act and to intervene, to mobilize additional and sufficient workforce, experienced workforce to support the limited number of workforce that they are running the health system in Gaza. Thank you.
Yep. My 3 minutes. Thank you. I mean, I'm going to repeat quite a bit of what's been said already. I think the most important thing to say, we've heard how physically and emotionally these healthcare workers have been almost destroyed out there. And that's not an exaggeration. They've been doing this for 11 months now. And they're all ill. They're all profoundly emotionally stressed. They're all physically ill as well. The vast majority are physically ill as well. And one cannot underestimate that. And they need lots and lots of support. But I'm afraid none of it's going to work until the war stops, until there is a ceasefire. And that might seem a very obvious thing to say, but it's the case, I'm afraid. And anything we can do, will do, is frankly a drop in the ocean until it stops. And so the single most important thing is to persuade our politicians to put pressure on them to stop this. That goes without saying, but I think it needs to be emphasized. The planning for the rebuilding is so important. When I last left Gaza in May, the medical director of Al-Aqsa Hospital said, please come back. But when you come back, bring as many surgeons as you can to start reconstructing all the patients. I'm a general surgeon, so there are thousands probably of colostomies that have been formed, for example. Patients with stomas. There is not enough equipment to look after those. There's not enough stoma bags. So these poor people going back into the camps with stomas, leaking feces out, and they can't control them. So they want surgeons in there to reverse the stomas. So we need to be poised, ready to go back in with immediate effect to start all the reconstruction and putting the patients back together again. There's all the resources they need. They need food. They need cigarettes. We may not want to give them cigarettes, but they want cigarettes. A cigarette at the moment in Gaza costs $10 per cigarette. That's how much it costs. And that's what they want out there. They want healthy food. They want water.
Thank you. Well, that's an overwhelming amount of support to given in an overwhelmingly complex situation. We heard mainly about the immediate needs for how you can need to rebuild the system, need to rebuild the infrastructure, support, physical, emotional support. The time now, I think, I'm not sure how much time is left because I've lost track. We have half an hour. Oh, that's great. We have 10 minutes for questions and answers from the audience. Let us run around. Could you direct and please speak clearly in the phone, in the microphone, so Dr. Tamam can hear you?
Yes. Hi, I'm Dr. Saragali. I'm a spokesperson for Doctors for Gaza. We're a health workers collective here in the Netherlands. I want to thank the organizers of this day and the people participating because you're doing incredible work. But when I look at the program and I'm listening, there's something a little bit missing for me. There's much focus on rebuilding the healthcare system. But doing that while there's an active genocide going on feels a little bit like talking about the rehabilitation of a patient while he's still in the ICU fighting for his life. With Care for Palestine, we have an initiative where we are thinking of a different strategy. In the current context, we're heading towards a year of diplomacy and of urging our political leaders for a ceasefire. And we have not come one step closer. And we have come to the sad conclusion that we may not be able to stop this war machine, and we should maybe focus on stop fueling it. There is no room, I think, for ethical arguments anymore. I think every ethical argument, everything that could be said has been said many times over. Recently, we have seen Israeli tanks ramming UN health workers that were on their way to vaccinate children against polio. There's a report of Human Rights Watch that health workers are being arbitrarily detained, tortured, and raped. And it's being said by the Likud government that it's in the parliament that it's allowed to do that. So the question that I have is, if we're going to look at how to stop fueling this machine, I would very much like to know from the people on the ground, what do you think of this strategy? Do you have suggestions on how we could do that? Because I think the Palestinian civil services have to be implemented, and also from other parties also here in the group, how can we work together to achieve that? Because as beautiful and as good as it to make for plans afterwards, I think that the focus should be on that ceasefire, and I'm afraid we're not going to get that to the politicians.
Thank you very much. I give the floor to who would like to answer this question? Dr. Tamam, Dr. Professor Maynard? Tamam?
Thank you very much for the intervention. And you're absolutely right. There are two issues here. One of them is the technicality, and this is where I was talking about the triage, because I am afraid that with very little resources, talking about rehabilitation, rebuilding might seem like wishful thinking. That is difficult to justify engaging in when the active targeting and the extermination of people of Gaza is ongoing. The ICJ has deemed what happened a feasible act of genocide, and to talk about what happens in the future might risk putting the current situation in less dire expression. So I thank you for that intervention. The other one is, we have to be extremely careful when we talk about what can be done and should be done in a situation like Gaza, from being unintentionally illustrating the situation as manageable, as there's something to be done about it, when, as you mentioned, there's very little that can be done, and with very little efficiency. The expression that has been used before in the Balkans and in Rwanda was a humanitarian alibi. If the humanitarian sector, the health sector, say that we can do something, it might be perceived or misused or abused to say, okay, they're doing their job, so everything is fine. So there's obviously no generic answer to your question or intervention, because the alternative saying we can't do anything and we shouldn't do anything until the fire stops, and that is also an unfeasible position. So I think a lot of it is case by case, is intervention by intervention, and is strong and clear advocacy as well. Thank you.
Okay, thank you. We have 10 minutes for questions. Can we have maybe one more, some additional questions? Because I think for every question we can have a long time. And thank you for this really important question and not an easy answer, I don't think.
Thank you. Excellent panel. My name is Mayeda Zobi. I'm the managing director of the Kid Institute. And I hear all of you calling for greater advocacy because obviously it does start with the ceasefire. All of us want to do as much as we can with the tools that we can. I can't declare a ceasefire, obviously. So you're asking us to do greater advocacy. Who are we advocating? What are we advocating for? What do you prioritize? We struggle at organizations like KIT, we're a knowledge organization. We had trouble even bringing the Ministry of Health, Ministry of Foreign Affairs to this event. They are here, but it took a huge amount of effort. How can we advocate? And just, I'd love to get a little bit more clarity specifically around what more we can do.
Yeah. To be honest, the barcode or the entry point of, not preventing such kind of historic crisis to happen again, even in Gaza or in Palestine or somewhere. Global alliance, mainly formed from powerful stakeholders from the South, global, to actually shape or to pressure based on really powerful framework. So we need we have a lot of powers in this on the South globals, whether governmental or non-governmental, community, in different areas, including health. So we can make a pressure. So now it's a time of mobilizing all efforts and resources and capacities. So we have a block, global block within the Western, who are just documenting the crisis and the atrocities without any serious action on the ground. Especially the WHO has failed to do some urgent, tangible of stopping something, attacking one facility. It never happens in Gaza. So we need now a global alliance to confront the other entities or bodies that actually covering what's happening now, documenting, observing, and doing little in the context of a huge crisis. I think this is the entry point, and we have already many potentials in the South, in the global global South.
This is a great question. I think advocacy is probably the single most important thing we can all do at the moment, and it's in many ways a lot more powerful than some of the interventions that people have been doing, simply because we need to get this to stop. And the only people who can stop this are our politicians, and that's where our advocacy needs to be directed through the media as well. And I think any of us who've been out to Gaza and witnessed the genocide, the war crimes, the appalling atrocities, need to be given a voice and need to use that voice to describe what they've witnessed out there and go and see the politicians. And it's going to be up to people like us, that the people on the ground, the public who march, who protest, who put pressure on the politicians. So that's where all our efforts need to be directed, in my view.
Thank you very much. One more question, I think, and then we need to move on to your ideas.
Hi, good afternoon. Celine Maia from Juzur, from Ramallah, Palestine. I think to spin back to the idea of supporting the healthcare workforce, a main theme that's been brought up constantly throughout this, genocide, is that the workforce is exhausted. Doctors and nurses are exhausted. They're tired. They're mourning. They're in pain. They're struggling just as much as anyone else in Gaza. And yet we know that throughout healthcare systems in the world, we have a limitation for just how much doctors and nurses can work, because we know that their quality of work is directly put out onto their patients. And we know that there's room for error when they work, under tough circumstances and when they're overburdened. And yet in Gaza, we can't really have these limitations. It's all hands on deck. We know that there's a need for doctors to work 24/7 with just the amount of patients that there are. So the question is, if we really want to support the workforce and yet we want to balance the amount of, healthcare that's needed, How do we set this criteria? How do we tell doctors, okay, you can take a break now, you can take care of yourself, when we know that there's, you know, they really can't. They can't stop working. We want to work for we want to set this limitation, we want this criteria for them, and yet in the context of Gaza this has never been done before. So really just the question is, how can we support them, and where do we draw the line? Where do we tell them to stop, and where do we tell them to move forward with their work?
Thank you so much. Dr. Tamam, would you like to respond to that?
I mean, it's, as far as I'm concerned, it's very simple. I can't, no one outside has a say a thing to say and inform or instruct doctors and nurses and health workers in Gaza. No one will ever blame them if they rested or stopped, or there's just so much humans can take. They will decide. They are the ones in there. I wish we can say, but I doubt that they don't know that burnout is not a useful thing, that the more they can serve themselves, the more they can work into the future. But sitting wherever we're sitting, I don't think we have a thing to say that will add to what they know and what they can do.
Yeah, we've said it before, little can be done, I'm afraid, to really help them until the constant bombardment and attacks stop. But there are now much more doctors who've managed to get in there than early on, you know, than 10, 11 months ago. But it's a wonderful credit that so many emergency medical teams have managed to get in there, and healthcare workers and humanitarian workers. And what I'm about to say is not a criticism, because I'm in awe of everyone who's gone in there, but it's been done in a fairly uncoordinated way. And we've got to learn from the way it's been done and do it better. The Gazan doctors, the Gazan nurses, the other healthcare workers, they're the ones that know best how to get this working properly. And there's quite a lot of people going in there and not necessarily working with the Gazan healthcare staff. And that is the single most important thing, to work with them, ask them where the need is greatest, work with them in a coordinated fashion. And that will be an enormous help to the healthcare staff there. They know best how to work now and also how to rebuild in the future. And they need to be central to that and driving it further forward.
Yeah, in addition to mobilize international medical teams, especially the specialized services or advanced services that is needed in Gaza, we can support this initiative by launching a call to invite or remobilize the Palestinians' expertise who left Gaza before the war and during the war. I'm trying to bring an urgent practical solutions. So we can't wait days to actually see things happening. So launching a call to invite, including me as a nurse, I can join direct. I'm trying to join the team in Gaza since the war started, but I couldn't, due to different, logistical and institutional reasons. So international medical teams need to be largely mobilized into Gaza, supported by, bringing back the Palestinians, the Gazans who already expertise, and also knowing the context very well.
Thank you very much. I see one hand online. I forgot to say, to acknowledge the people who are joining online. I just would like to ask Mariam Karimi, did she put something in the chat that we could respond to? No, oh, there. Oh, thank you for these questions. So, thank you for this. Could you have a look? The question is there. What about legal routes? So she asked, Mariam Karimi, thank you for your question, Mariam. You ask about advocacy, because you say there are quite already robust systems in play that circumvent advocacy. What about legal routes, testimonies, or using some accountability framework that we would hope exist on the global flat platform? So this is building on your question. And then next, please, could you answer, because otherwise people can't hear you.
Talking about the legal routes, what we have started here is we have taken the services of Liesbeth Zegveld, which is the same lawyer that won the case against the Dutch government to force the Dutch government to stop exporting weapons to Israel. And she has agreed that there might be some good legal opportunities to force mostly investment organizations, but also universities and other companies to respect the ICJ ruling of the 19th, because that was so clearly demonstrated that it's made it illegal, that it would maybe even constitute money laundering by mixing legal money and illegal money. Now, if this ruling of the ICJ is not applied, it just hangs in the air and it does nothing. So the idea would be to see if we can get to a point, hopefully in the coming months, to start a legal procedure about that and hopefully create some jurisprudency so we can then start tackling as a domino effect the other companies. But this will be the first time that something like this is attempted, so it's quite an endeavor. And I would be very interested if there are other organizations that are looking at those legal routes to see if we can unite our efforts in that.
Thank you very much. I hope this has answered your question, Mariam. And for now, I would like to, we have another 20 minutes, no, 15 minutes left. So we heard, in fact, two parallel routes. One is on trying to stop actually the war and have advocacy around how to do that. And the other one, addressing the immediate needs of the health workforce by mobilizing emergency teams and supporting two international experts, but also Palestinians outside Gaza who would like to really contribute. And probably we need to include the West Bank there as well. And then we discussed, now I'm losing my thread. Okay, so then we also looked at the importance of coordinating these efforts and not duplicating, which I'm honestly find a bit sad that we hear this again, because this is not the first time we hear that there's a lack of effort in emergency, of coordination efforts in emergency situations. It happens time and again, and I find that, I hope that this can be sooner addressed. Anyway, for the next 20 minutes, we would really like to invite you and see if anyone who is in this audience would like there to share their ideas of how could we best address the challenges that the Palestinian, of the Gazan health workforce faces. How can we help them? What are your experience and suggestions that we could be informed by? Anyone who would like to exchange, then I would suggest we do two people reacting, then ask the panelists to give their ideas, and so on until we reach our end. I see somebody at the back. I'm running. Okay, I'm running. Let's come to each other.
Thank you ever so much. Thank you. Thank you ever so much for organizing such an important event. My name is Haifa, and I am a GP practice nurse, originally from Palestine. I live between Palestine and England. I also opened my own medical center inside Jericho under registration of a doctor from Hadassah, Dr. Omar Safi. I worked very, very closely since the 7th of October with doctors for the patients also from Gaza. We have up to 9,000 patients who are unfortunately being forced to be from Israel inside the West Bank. And what we managed to do is try and support these patients. And it is really, really difficult. We have at the moment 600 on the door of Rivers of Mercy, and we're trying to support them with what we can. I worked with MSF. I know I have a bit of an idea to hopefully bring things up and able to see other organizations who are able to support us to implement a route for people from Gaza who are in the West Bank. Unfortunately, is extremely horrific situation inside, but also we have a serious situation on the West Bank on the ground. And I'm talking about Palestinian from the West Bank, but also especially Gazan. And if you own sort of reference, people inside from Gaza, inside the West Bank, they don't get the same rights. And therefore, they rely very, very much on our help, on our support. And I might be not able to answer or highlight the same point you're highlighting, but the real situation is we are really struggling. And the real situation also from the echo sound of safety. So when I'm traveling from England to Palestine, I can't tell you the anxiety I have. I also have volunteers who travel from around the world to enter Palestine. And it's very, very difficult on a daily basis to enter the border. We don't know whenever they're gonna demolish that sort of clinic we're trying to build. And whoever sounding, I'm not even going to politics because that's one thing I'm always kind of curious and worried about. But I'm here to kind of bring the fact on the ground that we're trying to do something. So I'm a GP practice nurse, but I try to specialize in many, many areas, including advanced clinical practitioner, to be able to help and support as much as I can. So I am here, came from England, lived with my 2 children, under 2s, just to stand here and say, I and the team in Palestine, we need the proper support, and we do not need the real promise from every single organization to be able to stand firm, and we're able to help, and we're able to help in the right manner, and also implement what we can implement in England and what we can implement in Europe, we can implement in Palestine, such as a free medication, free transports, and able to implement also. We have in Jericho, we have 1 hospital, 50,000 patients, we have 1 hospital. And a lot of healthcare professionals are screaming for support. A lot of patients, they're dying with absolutely no interventions. And I really thank you for giving me a few minutes, and I'm really sorry.
Sorry, thank you very much. Thank you very much. Thank you very much. So this is an outcry for support, and thank you for coming here to tell us that. I have one person. I'll give you first.
Hi, Dr. Madeline Azar. I think, I think that it's very frustrating because there's nothing we can do from the outside for the doctors inside of Gaza. And if as a group we're trying to work on what to do in helping the health needs of the healthcare workers, I'm an occupational medicine physician, I think we just need to prepare so when the gates open, when the war is over, because we're not getting stuff in, we don't have any internet access, is to have a team go in that are prepared to go in and help these physicians who are traumatized, with social workers, with medical care, because we want to keep the healthcare workers in Gaza. We don't want them to leave and then never be able to re-enter.
Thank you very much. So I promised 2 reactions, and then we would ask the panelists to react. So the floor, who would like to talk? Can I give?
Yeah, I mean, wonderful to hear what you're doing. Congratulations, it's fantastic. I mean, I'm embarrassed by the behavior of my country, to be perfectly honest, and our government. I really am. And it's not despite a huge amount of advocacy from many people trying to persuade them to do these things, but I am frankly embarrassed by the lack of will of our government to help with this. What I'm very proud of in England, and I'm sure many other countries, I go to Ireland a lot as well. In Ireland, there are vast numbers of healthcare workers who work in those countries who are not only desperately sympathetic, but desperately keen to help in any way possible. Then, many of them won't want to go into a conflict zone, but many people, I have huge amounts of people who've said they want to go in the minute it is safer in order to help with the rebuilding and to help in any other ways as well, electronic telemedicine. So I'm very heartened by the huge amount of people who will help when they're given the ability to do so.
Dr. Zamami, would you like to react to this? Yes? Maybe on
I want to go back to the coordination part, working with health workers in Gaza. And I think this is general for humanitarian organizations. It hasn't, we haven't always proved to be the most collaborative or coordinated bunch. And I think this is not something we can afford to do again. So I just want to echo that, and a lot as it stands from MSF perspective, we've worked in almost every hospital in Gaza as much as we could under the circumstances, and it's always been the vast majority of our staff are health workers from Gaza itself, and they led most of the work. I think this is important. It is important to find mechanisms to coordinate humanitarian supply and so on. It is very erratic. When can we and how much can we get in, both in terms of people and supplies, which hinders the possibility of coordination even further. But I just wanted to mention that this is we're very conscious of that, and would be absolutely hoping to be able to do it much better in the future. Thank you.
Yeah, just a few seconds. This unprecedented crisis has changed even the norms, the concepts, and the definitions of many things, to be honest. It's not in the healthcare sector or public health issues or healthcare service. It's a time to change the mindset in all things, humanitarian design, the local and international collaborations, the training and medical education, the way of integrating the technology, telehealth in the systems, especially in the context of, Gaza, Sudan, Yemen. And it's a time of, thinking differently in terms of, advancing new impactful advocacy tools. I had experience during the last month with many leading medical journals. They actually trying to silence us. I wrote a paper about how the global health community reacting with the crisis of Gaza. And I got 4 rejection, including the Lancet, because we are trying to criticize their limitation. 4 rejections from 4 international leading medical journal. So we need to change the mindset in all things.
Thank you. We have 8 minutes left, which means that we can have 2 more reactions, and I see 4 hands. So this is random selection, sorry. The man in the back, and then you. Sorry about the others.
My name is Islam Nalayev. Sorry for my English, it's not good enough. I'm actually here from a Living Lab Neurosurgery. It's actually a small NGO in Netherlands. What we're doing actually is for pre-traumatic care before the patient comes to the hospital. What can we do? Little bit background for me. I'm born in Chechnya. I'm a little bit nervous now also. The reason is I was a child when we have war against Russia. 7, 8 years old, seeing what happening. At that time, I asked my father, where is the world? And the same thing happened now in Gaza. Every time when I see the images, it brings me back to my childhood. And then the questions, what can we do? Okay, the same question I asked also. I've been in Morocco, in Turkey after earthquake, have there learned some things. And then when this is happening in Gaza, few medical staff asked me, Islam, can you send someone to Gaza? Okay, I want to think about that. It is not a part of what we are doing, but from Living Lab Neurosurgery, we say, okay, we will build EMT. We have nothing, but we will start it. And then action with thinking, if it will be better, if it will be safe, we go there. So we have 40, almost 60 surgeries, anesthesia, nurses, My background is ICU nurse and ER nurse in Erasmus Medical Center in Rotterdam. And then we're waiting. We have not WHO classification, not yet, but we're working at that. But now coming, we are waiting and the people are dying. As medics here maybe know, if you have arterial bleeding, you can wait and think. You must act. What did we from Living Lab neurosurgery? So at this moment, I've been in Cairo before the Rafah borders were closed, with sending them medical supplies, medical supplies in Cairo, helping NGOs, deep respect for the UK Med also in Cairo. Now the borders are closed. What can we do? Okay, the EMT is here waiting, but we can't help them with the EMT. I'm not a lawyer. I can't stop the war. But the next, we have here in Netherlands NGOs, big NGOs. I say, you're collecting money. The arterial bleeding must stop. Help us. Let we get together. Help. Now we are doing is we supporting the medical point in Deir al-Balah. We sending food baskets. I've been twice in Jordan. Meet GCI, JACO. If the people here are, they maybe know, there are the logistics, transport companies. You can bring, you can help, you can do the really stuff. So we bring 2 times that I've been there with colleague, 6 pallets of medical supplies, the Indonesian hospital. The connections are this, we can do really something, but don't wait thinking it will become safe. No, you must act now. Yes?
Thank you. Sorry about that. Yes. I hear so much commitment and so much urgency feelings of wanting to act, and so much frustration of non-political will and lack of global platforms to really work together and push governments to change. So yes, I think you wanted to say some last words. I'm sorry, I don't think we have time for the panel to react anymore.
Hello, my name is Jennifer Davis. I work at Jazur for Health and Social Development. It's a local NGO in Palestine. What I wanted to say today is that since October 7th, we shifted all of our projects into supporting Gaza and to supporting the health in Gaza. And one important point I wanted to point out is this all came out from our director in Gaza, from Dr. Yahya Abed. And what he did is he called us up and he's like, okay, people, what are you going to do? How are we going to change the situation? How are we going to help the people in Gaza? So my point is that we should leverage the resources that we have in Gaza. We should start thinking about how to support them and not just how to bring in more people into Gaza. That is what we need for the immediate response. But what about the recovery stage? And what about rebuilding Gaza? We need to actually think about all the resources that we have there and how to benefit from that. As Jazur, we are actually working on that, and we have built the capacities of midwives, for example. We provided them with trainings so that they could have safe deliveries in shelters. We provided volunteers with trainings on how to stop the bleed so that they could assist doctors and be the first responders to any emergency that's happening in Gaza. So we should think beyond the point of just sending out medical teams to Gaza to support immediate, and we should think about how are we going to rebuild the health system. Thank you.
Thank you. Thank you. A very nice addition to not only dealing with the immediate needs, but also working together with the local health workers to look into further supporting what is available and thinking further a bit into the future for rebuilding. We would like to have a last closing comments from the panelists. If you may, just 1 sentence, is that possible?
Maybe a reasonably long sentence, but it's really inspiring hearing some of what you've said. I've loved it, and it's really sort of gives us even more hope that things will get better. So my 1 sentence, that was an introduction. Just a few comments about the NGOs. We can all learn from the way things have been done. every single one of us can do things better out there. And I think we need to learn from the last 11 months. I think the NGOs have to have really good support on the ground. Medical Aid for Palestinians, whom I go out with, have got the most inspirational group of people I have ever met in my life. Their Gazan local staff work for MAP and support the medical teams there and do it brilliantly. I don't think all the NGOs are lucky enough to have that, but they need to build that support on the ground. And the people who know best about how to provide care now and how to rebuild are the Gazan healthcare staff. They need to be behind this. They need to drive this. They need to lead it with our help, but they need to be at the forefront because they know best.
Yeah, I think the way of addressing the current crisis should be at 3 levels: political, managerial, and also technical or clinical. So this is for the healthcare related part. But for the institutions or the stakeholders, we need to mobilize again, more capacities to the Palestinian institutions to be able to restore their functions and operations. And we need to think about this crisis from the strategic perspectives for long generations from now. So this is an important point that we need to highlight.
Thank you. Dr. Tamam, your last closing sentence. He's muted.
Thank you. Thank you very much. And it is true that I do appreciate all the interventions and desires to achieve much in Gaza under the circumstances. I just want to, while continuing to work under the guidance of people who know the ground better, the Gazan health workers and people who have experienced it very closely, I just want to keep distinguishing between the immediate humanitarian intervention that is needed now to stop people from dying or suffering, and preventable deaths and suffering just at the moment, from the longer term reconstruction. I think if we had every time and every resource in the world, it would be possible to think about them all together. At this moment in time, with tens of thousands of people who are injured or who have treatable diseases that might not survive, I think a close focus on the direct, immediate humanitarian intervention that saves lives now might be a good, part of focus on our side. So thank you very much.
Thank you very much. So we have come to a close for this session. So because it's lunchtime, that's how what happens, right? I would really like to, oops, he's gone. I would really like to thank the panelists, Professor Maynard, Dr. Mohammed Al-Ghadi, Dr. Tamam Al-Awdat. I know that it's taking your precious time to come here, so really thank you for your valuable inputs and good flight back for you. I know you are rushing off for other things to attend. So much thanks. And thank you for all of you as well for your insights and your commitment and your motivation. If it would be up to this room, the problems would be solved tomorrow. So if you could combine our forces, who know where we will get. Before you leave, we have a Mentimeter. Please help us.
Yes, so you've already seen the code on the screen. So just as a reminder, today's conference is really trying to take all these findings and try and see how we can build on that. So part of that is really reporting what we've done in this session. And our colleague Mirta has been really working on this, but we really would like your input in this as well. And so there's this slide, but we'll ask maybe to go 2 slides further, please. Yeah, we would really like to ask, what is your key takeaway from this session? Recognizing that we all see that the ceasefire is obviously the one big thing that needs to happen, but perhaps also some of these other inspiring quotes and stories that we've heard. So I would invite you to please share that with us, and we'll take it with us, and we'll report it also to Pierre for this afternoon. And then I would also like to thank all of you next to our panelists for being here, and thank you for sharing all your experiences. Thank you so much.
Thank you.
Thank you so much.
Thank you.
It's amazing.